Thank you and good morning everyone. May I also begin by acknowledging the traditional owners of the land on which we meet, the Dja Dja Wurrung people of the Kulin Nation, and pay my respects to elders past, present and emerging, and any First Nations people here today, and a warm welcome also to our Aboriginal and Torres Strait Islander health workforce here today. I'd also like to acknowledge Associate Professor Jane Tomney, the Director of the Centre for Excellence in Rural Sexual Health at the University of Melbourne, Rick Kerr, our Dja Dja Wurrung Elder, the Honourable Fiona Patton, Member for Northern Metropolitan Region and Leader of the Reason Party, Associate Professor Christopher Fisher, Australian Research Centre in Sex, Health and Society, Yumi Steins, broadcaster and writer, and ladies and gentlemen and conference attendees who have travelled interstate and across Victoria, either over the course of the last 24 hours or this morning, such as myself. It's terrific to be here this morning. Sorry I missed the dinner last night. I hear it was great. I'm here representing the Department of Health and Human Services and really excited to be here for the SexRurality Sexual Health Conference, the fourth so far. I'd like to say that it's great to be able to support the wonderful work of all of you here and many others in sexual and reproductive health. As Jane highlighted, my early beginnings in clinical practice had me sort of trying to break what was considered a taboo subject in mental health, particularly the sexual health of women with a mental illness. So it's a deep passion of mine, and I'm really thrilled to be here, so thank you. So I guess I don't think anybody here underestimates the public health and personal impacts of sexual and reproductive health, especially for some population groups who are our most vulnerable. It's also an interesting, exciting and challenging time within the sexual health landscape. We've had a number of exciting clinical and technological advances that are changing the models of care. We've seen increasing uptake of clinical prevention, treatment and support services around various sexual health needs, but we're also seeing a changing epidemiology around what those sexual health needs look like, and I think it's some of which is kind of moving us away from what was considered to be quite heavily focused on HIV and an epidemic around the HIV spread to something where we've now recording some of the most unprecedented levels of sexually transmissible diseases, STIs in the form of chlamydia, gonorrhea and syphilis. Certainly the disease trend is shifting. We've got clinical advances that are driving a new way of people accessing services and the types of services that they can receive. At the same time as some of these STIs, we've even recorded some antimicrobial resistant forms of gonorrhea which are concerning and raise a level of clinical complexity that we haven't seen before. I guess we've been struggling to work through stigma and discrimination in this area, and whilst we've made a number of inroads, there's still concerns around the lack of inclusiveness and judgment that people experience when they're accessing services. So I think one of the challenges for us will be not just the access and inclusiveness and quality of those services and ensuring that we keep pace with contemporary practice changes, but also some of the very fundamental, somewhat intractable issues we continue to have around geographic access and equity for all Victorians, and we continue to see issues. I was just reading this morning, again, we've got some rural communities without a local GP. That has a significant impact on the types of services that people can receive, including sexual and reproductive services in those small towns. I guess that I'd like to also highlight some of the opportunities that the department is looking towards. I understand a number of you have been involved in our consultations, including the Engage survey around the review of sexual health needs and clinical sexual health services in Victoria, and I do really thank you for your participation and honest feedback. I think that it's the only way we'll be able to improve our current services, and some of the key themes from that I'd be keen to share with you this morning. I'm sure that many of those themes won't be a surprise to all of you, but I think it's important to kind of remain current in our thinking and continue the impetus and momentum towards addressing these concerns. Certainly demand pressures are being felt. As I said earlier, with the increasing uptake of certain types of services, we're seeing some real issues with demand, particularly in some of the metropolitan centres. But the broader availability in rural, regional and outer metropolitan areas continues to be a concern. There is no access for some, within a 100-kilometre radius, and for others, the access may be there, but it's quite limited in terms of the comprehensive range of sexual health services that support people to achieve optimum outcomes. The cost and travel, therefore, are significant barriers for people that were being cited through the consultations and the survey, and people felt that they would pay and travel if those services were more inclusive and non-stigmatising and fundamentally confidential. And I think that's quite important from a service user perspective to understand what they were ranking as the higher priority in terms of the nature of services that are available to them. I think that people felt, another key theme was that people felt that there was a lack of service integration. It depended on which health professional they were seeing, whether they felt that they were then able to access a range of supports and do that in a way that kind of addressed the range of their sexual health needs. That some of the concerns also centred around being prescribed the wrong medication for certain types of STIs. So again, the knowledge and training was highlighted as an area for improvement. And overall, more broadly, people felt that our system is slow to respond to some of the emerging needs, including underutilising more contemporary practices such as nurse-led and peer-led models of care. So what are we doing with this? The branch that I work in, we're looking at working with the Departmental Advisory Committee on Bloodborne Viruses and STIs, on which Jane is a member, to look at how we consider opportunities to address these concerns. More broadly, we've got a system at the moment which is fairly focused on the specialist services and increasingly expanding access to services through primary care platforms is being highlighted as a priority. But how we do that, there's a lot of colour and movement between those two ends of the spectrum. So we really are keen to work through the design issues and implementation issues with our Departmental Advisory Committee. But also making it happen means working with all of you and others in the field. And in particular, I think it's fair to say there'll be a strong focus on what more we can be doing across rural and regional Victoria, where we continue to see significant gaps in access, but also, consequently, outcomes that people have in this area. More broadly, I think people are aware of the Victorian strategies for viral hepatitis, HIV and STIs have been a focus. And just last week, Public Health and Wellbeing Amendment Act was passed by the Victorian Parliament, and it's terrific to see such an outdated clause around special requirements needing to be met for HIV testing being repealed as we move towards targeting our target of zero stigma and discrimination for people with HIV and other sexually transmissible diseases. We are excited that in this year's state budget, the government announced the continuation of the rapid HIV testing service at Pronto. That was funded another $2.8 million over 4 years, and it's played a key role in increasing the uptake of HIV testing and the use of PrEP as part of multimodal treatment and responses to these issues. I think it's a number of you will have been involved in the implementation of the first ever Victorian Women's Sexual and Reproductive Health Plan. That's exciting. That's an example of where we are trying to establish service hubs within primary care where there is some specialist expertise, both medical, nursing and allied health, around the range of sexual and reproductive health needs of women. And of the 8 that have been rolled out over the last few years, we've actually got 4 in regional Victoria, in Bendigo, Ballarat, Wodonga and the Wangaratta area and Gippsland Lakes. So that's 8 so far, hoping for more, and that plan is due to be refreshed towards the end of 2020. So watch this space. We've also been really thrilled to see the uptake of the 1800 My Options statewide phone service and website. There have been approximately 5,000 calls to date, which is great. And interestingly, a lot of those calls are around seeking advice on pregnancy and termination services. Next month, we will be running our 3rd STI testing week from the 8th to the 14th of September. To increase awareness of regular sexual health care for sexually active Victorians with a talk, test and treat theme, and it's an annual reminder for all people who are sexually active to look after their sexual health and prevent the further spread of disease. I know that a big focus for us is around how we support members of the community to access services information and services in a timely way. And provide those to the highest quality that we can. But achieving that does require a level of support to the workforce, not just training, but a number of resources and other tools. And this is where the Centre for Excellence in Rural Sexual Health plays a critical role, and it has that mantra of supporting our workforce in terms of its capacity and capability building. So I'm delighted today to be able to officially launch the Centre's resource hub. It's got over 100 free resources, tools and materials available online, and it's a dedicated information hub and portal to support health practitioners working in the domain of unintended pregnancy and abortion. I'd also like to acknowledge the partner organisations in the Resource Hub, the Royal Women's Hospital, Gateway Health, Children by Choice and 1800 My Options, who have shared their advice, support and resources to make the hub as useful as it can be for all of you. I am also pleased to promote and support SERSH's online learning modules for GPs and other health and allied health professionals. It was launched here at this conference 2 years ago, and there are now 12 modules, including the latest module on syphilis care. And so I don't know why I forgot about syphilis. For antenatal women, it's a pretty tragic scenario to have had 2 congenital deaths of babies as a result of syphilis, and that sort of situation is unacceptable. So a focus around that is more than warranted. And just a reminder that those modules are available online and for free, eliminating the barriers of time, cost and distance, which we all know are big when you work in rural Victoria. So I'd like to finally commend Associate Professor Tomney, her team at SERSH and the University of Melbourne for these innovative approaches to professional development. I hope that everyone over the next 2 days has the opportunity to explore the complexities and opportunities of sexual and reproductive health in regional rural Victoria from both your personal and professional perspectives, and work together to share those learnings and improve access to care to better meet the needs of and complexities of our priority populations. The department looks forward to continuing to work with you and to support the terrific work that's being undertaken both across clinical practice, community development and research. And I thank you again for your time this morning and wish you all well for the remainder of the conference.